Hello and welcome to Serenity Birthing, your birth and beyond the way that resonates with you. With me, Shelley, the Serenity Doula. This is Module 4, Optimal Fetal Positioning. We're also going to talk about birth preferences and care plans in this module. We're going to cover what is optimal fetal positioning, how we can encourage the baby into the best position for labour, and what you might like to consider for writing your birth preferences and care plan document. So what is the best position for the baby? Well, it's a position called left occiput anterior, which sounds very technical because it's in anatomical terms, but it means that your baby is lying head down with the back left of their head towards the front of your pelvis and their spine up your front left side. So the majority of the weight of the baby is on the left-hand side of your body. This position is most favourable for birth, as the smallest part of the baby's head is then presenting to the cervix to fit through the pelvis. Now you might like to watch my video about the birth of the baby and how they move through the pelvis. It might help you to understand what those terms mean and see why it makes a difference to the birthing process. So, how do we encourage your baby to get into the best position? Well, first of all, use gravity to assist the heaviest parts of the baby to move forward. So, in these last few weeks of being pregnant, make sure you are sitting leaning forward and not slouching back, that you are lying on your left side and not your back, that you are spending time on all fours or in forward leaning postures, and that when you sit your pelvis is higher than your knees so that it is tilted forward and not back. Spend time swaying with your hips and dancing or sitting on a birth ball. So in the positioning video, it'll be much easier for you to see why these are important. But if you slouch backwards, it tilts the pelvis back and moves the baby towards your spine. If you lie on your back, exactly the same things happen. So your baby's then having to work against gravity to get into a good position. So really we want to make things easier and use gravity so that they are more forward, not putting pressure on your spine, and that their head is in the optimal position for labour. When you sit, if your knees are higher than your pelvis, you can see that it starts to tilt your pelvis backwards. And again, this is going to put that baby towards your spine and out of that good, comfortable position for labour. If we put the knees the other way, so they're lower down and your pelvis is higher, it tilts everything forward and gets that baby into a better position. Now I don't want you to worry, because sometimes babies choose different positions. Sometimes they turn at the last minute in labour. Sometimes they turn during labour. So don't worry if they are not occiput anterior. Their position can also be difficult to assess, so you may be told that they're not in the occiput anterior position, but they may actually be anyway. And also, just to say, not to worry, because there is actually no conclusive evidence to say that the baby in a posterior position can cause back pain in labour or a longer labour. So don't worry, just do what you can to use gravity and to help into a good position. So use this opportunity to talk about helpful labour positions. So we spoke briefly before about not lying on your back and how this can increase discomfort in labour. If we use gravity in upright positions, it helps the baby descend into the pelvis, so they're not having to work uphill and your uterus isn't having to push them uphill, but is helping them to move down. Use forward leaning and upright positions to help open your pelvic bones and avoid pressure on your sacrum so it can move out of the way as the baby comes through. So you can see a few different positions here, kneeling with the leg out to the side, which opens the pelvic space. Leaning forward, either on a partner or over a trolley or a bed or over a chair or a birthing ball. Lying on your side, Usually lying on the left side is the best position actually, because the vena cava, which is a big vein of your body, is on the right hand side, and if you lie on your right hand side the baby can actually compress this a little bit. So in order to get that baby over onto that left side of your pelvis and to stay away from those large blood vessels that can be compressed, lying on your left side is better. You can have your birth companion help support your leg on that side out of the way. Some people choose to birth their baby lying on the left hand side. It's quite a comfortable position. Then the pictures over on the right hand side here you can see are of a birthing stool. So this is good for during labour to help that cervix dilate and open and create space in the pelvis for the baby to come down. But it may be better to just change the position into a more of a forward leaning one when the baby is beginning to crown, just because it takes that downward pressure of gravity and that opening of pelvis, just dials that down slightly so it can help to prevent any tearing. Okay, let's move on now to writing your birth preferences. Now some people choose not to do this, but if you feel it's a good idea for you, then I would say absolutely go for it. It's a quick reference that the midwives and other medical staff can use to understand where your head is at without having to ask you questions. So I will consider making it no more than one A4 page, because often they do not have time to look at anything bigger. Remember to make it flexible, because the baby has a mind of its own. So maybe just include in there different scenarios of ways that your birth may take a different path and how you feel about different options on those different paths. It's helpful for you to really consider the things that could happen in labour and the paths that you may take, so that you've thought through before you're in a labour situation, in that where you're not in your neocortex. We don't really want you in your neocortex, we want you in that primitive brain. So if everybody already knows which way you'd like to go and what you would like done in certain situations, it means you don't have to think about it, and you can concentrate on keeping your oxytocin levels high. You're breathing deeply down to your baby, keeping the oxygen flowing as it should do. So allow for backup plans and your preferences should they occur. And if you plan for all scenarios, it just allows you to feel more calm if they do arise. So here's a little example of a birth preference sheet. It's in different headings and boxes, so everything's very clear. So we talk about who you would like attending during your labour and birth, perhaps your partner, a doula if you're having one, maybe a mother or a friend. Then on to labour and birth. You might want to be able to do specific things, like be free to walk around during labour, maybe move position throughout labour. Maybe you prefer to keep the number of vaginal exams to a minimum, or perhaps you don't want vaginal exams at all, and that's absolutely your right to say that you don't want them. There are other ways of telling how labour is progressing, so you can absolutely say that you do not want that to happen. It's your choice and your body. Also know that you can remove consent at any time. So if you've thought at the beginning that you wouldn't mind vaginal exam, and then one starting and it's making you feel uncomfortable, you can absolutely say stop and that you don't want it anymore. You can say that you'd like to be able to eat and drink as you wish during labour, have little sips and little nibbles. And you can also say if you would like your birth companion to discover the sex of the baby rather than them telling you. That might be a special moment that you would all like to share. Now moving on to monitoring of your baby. So have a think about what you would prefer here. Perhaps you would prefer minimum monitoring of your baby. Perhaps you would prefer it to be a handheld Doppler rather than strapped to you so that you have to stay still on the bed. Or perhaps you would prefer lots of monitoring. Really have a think and look into the research about how different types of monitoring affects the progress of labour in order to make an informed decision here. Now moving on to pain management and environment. So again, make sure that you've gone through the pain management module so you understand the pros and cons for different types of pharmaceutical pain management, so that you can make an informed decision and know the effects on you of pain management on you and your baby before you make this decision. Okay, so you may want to do things naturally and only them offer pain management only if you ask for it. So you may say that you'll be using massage or a TENS machine, music, maybe castaner. Perhaps let them know that you are using hypnotherapy techniques if you are, so that they know and understand that you're going to be calmer than they may expect from people. Perhaps you'd like to have the lights dim in the room, or maybe have a diffuser with some nice aromatherapy smells going on in the background. Just make a little note in that pain management environment there. Acceleration. So this is where there may be intervention in order to speed up your labour. And again, please remember that you absolutely have choice in this. You can say no if you would prefer that not to happen. If you don't want to have to talk about it during the labour, you can have your preferences here on your birth preferences sheet, so they know already that actually you would like it to take a natural course. You would allow the membranes to release spontaneously. You don't want somebody to break them for you. Or perhaps, conversely, you would like them to do as much as they can to speed up labour. As long as you've done the research and you're fully informed and understand the consequences, the pros and cons of each decision, then that will make you feel empowered during your birthing experience. Then we move on to the third stage. Most hospitals now understand that leaving the umbilical cord until it stops pulsating before it is clamped and cut is beneficial to the baby, and so hopefully they will understand this would happen. But it's a good idea to put it in your birth preferences just so it's stated clearly there. You may like to state here whether you are planning on a physiological or a managed third stage, so the midwife knows and they don't have to ask you during that time. On to after the birth. So have a little think about what you would like to happen, whether you would like your baby to be placed directly on you so that you can have skin to skin. Let them know that you would like to intend to breastfeed, and that if there are any examinations have to occur of your baby, that they do it with you there and not taking the baby off somewhere else. Perhaps they could do it with the baby on you as much as possible, or leave it for a while, as often a lot of checks and things are not necessarily immediately, so maybe leave you for a bit of time for bonding and to establish some feeding. At this point you also can put in your decision about how you would like vitamin K to be administered, if you would like it to be administered, so orally or injected, or whether you are choosing not to have vitamin K. Again, make sure that you've done your research so you feel fully informed and you're making a decision that feels right for you and your family. Now there's a section for caesarean birth. So there are options should you have to have a caesarean, or should you choose to be having a caesarean birth, depending on how the path of your labour goes. And you can place things in here that you would like to happen. So for example, immediate skin to skin, delayed cord clamping, as per the latest NICE guidelines. You'd like the room kept quiet and the lights dimmed apart from the surgical light that they need to see. You'd like a family-centred caesarean. If you're having a planned caesarean birth, it's a good idea to talk to your care providers before going in so that your wishes are understood before it's happening. And if there is an emergency caesarean, they are very rarely actually a rush in, nobody can say anything. That's called a crash caesarean, and those are extremely rare to happen. So there should be time for your care providers to have a look at your care preferences here, to understand what you would like during a caesarean birth, and your birth companion can also make those clear. So that's why it's important to discuss these preferences with your birth companions, so they understand what your wishes are and what you would like to happen, so they can convey your wishes whilst you are off in labour land and concentrating on breathing and raising your oxytocin and breathing that oxygen down to your baby. Your companion can talk to them and make your wishes clear. Onto the other section, you can put anything else that may be important for you. So whether you mind or don't mind student midwives or medical students being present, that you'd like to be kept fully informed of all developments and share in any discussions or decisions if you would like to do so. it's something that we've touched on briefly, and I'm going to mention it again here, that the birth of your baby is a fundamentally important time where the hormones in your body are really affecting how you feel as a parent. If you're feeling in control and part of a decision, it will make you feel much more empowered in your decisions in the future as a parent. So it's really important that you have thought about different eventualities, how you feel about them, that you've researched and understood the pros and cons so that you can make an informed decision, so that you feel in control of what is happening during the birth of your baby. It's important that you choose and do what feels right for you, because this is your journey of becoming a mother. It's not anybody else's journey, so it doesn't matter what other people think or feel. You need birth companions that support you and support how you feel safe and what feels right for you, whatever that may be. It's also important to note here that healthcare professionals also have to support you, irrelevant of their own personal feelings. They present information to you and should do so as clear statistics that are presented to you in an unbiased way. And even if you are going against what they feel is the right thing to do, they must honour and respect your wishes. Now that is protected in human rights law, and it's very important that you understand that. Do not allow yourself to be coerced or bullied into something that you do not feel right about. Always take the time to be able to discuss and to understand so that you feel that you are making a decision, not that a decision is being made for you. Now be flexible, because what feels right might change and the baby may have other plans. You are allowed to choose and do what feels right for you. If somebody is telling you you are not allowed to do something, that is not okay. You can always ask for a second opinion, or ask for somebody more senior, or ask for things to be explained to you in a different way if you don't understand what is going on. It's fundamentally important that at the beginning of being a parent, you are feeling in control, listened to, heard, and respected. That's where a doula can be really helpful, because they are there to back you up, to help advocate for you with your other birthing companions, so that you feel heard, understood, and empowered, however your journey goes. Each birth journey is different, and only you know your life experiences and your personality and your feelings and your fears and your worries, so you must choose what feels right for you. If you manage your expectations, plan for different scenarios and know your rights, then you are going on your journey very strong and well prepared. Okay, we move on to the practical exercise. I'd like you to take some time to consider what feels right and what feels important for you during your labour, so that you can write your birth preferences or care plan. Remember to be flexible and positive in your wording, and remember to give yourself time and space to reflect without judgment. Allow time before the birth to discuss with your companion or doula, and if you wish with your midwife, so that everybody is on board. Everybody understands what your wishes and your preferences are and where they're coming from. I'd just like to make the point here that you can make whatever decision about your birth preference you like, and you do not have to explain yourself to anybody. People should just respect your decisions. If you choose to share why you want something a certain way, that is absolutely your choice. Also remember to keep writing in your diary your thoughts and feelings, and any questions that have come up in this module. I look forward to seeing you at the next one. Take care.